Well, when we hear about menopause, we often think about women, but hormonal changes can also affect men as they age. Dr. Kumar is on call with what men need to know about what some are calling male menopause. I mean, I guess it's called menopause, so there you go.
Well, 2014 cover of Time magazine called it menopause. Now, the scientific term is andropause, and this refers to the natural decline in testosterone that men experience, about 1% reduction starting at age 40. Now, what's different with female menopause, there's a precipitous drop in estrogen level. Women feel like they're falling off a cliff. For men, it's kind of like a gentle stroll down a mountain. And how symptomatic a man is going to be based on lifestyle and metabolic health. But it's important to talk about it because a lot of men are suffering right now.
So this is absolutely a real thing. So do all men experience these hormonal changes, like you said, kind of going down this cliff?
Well, with men, like I said, it's more of a gentle stroll. And the symptoms that men experience can be insomnia, hair loss, change in muscle mass with reduction of muscle, more fat content to the body, sexual side effects like loss of libido, erectile dysfunction, and then even mood changes, anxiety and depression.
And there's been some controversy about hormone replacement for men. So where do we stand with men taking testosterone, especially midlife?
Yeah, this is a really hot topic. Now, testosterone is indicated for men that have low testosterone levels, and that's diagnosed with physical exam, laboratory testing, and also looking for secondary causes of low testosterone. You want to eliminate things that can be suppressing testosterone: testicular issues, obesity, smoking, drinking, opioid use, marijuana use. There's a long list. However, if all of those things have been eliminated, some men will find relief with testosterone therapy. But I want to say it's not a sure fix. The data doesn't suggest that all of those symptoms go away, and there are risks. There are risks of elevated cholesterol, abnormalities in liver function, blood count, contraindicated in men with prostate cancer. There was a recent study, though, that came out earlier this year that said that there is no increase in cardiovascular risk. That was an issue that we were concerned about in the past, but cardiovascular risk is not an issue with testosterone therapy.
And is there anything else men can do to counteract these symptoms? Maybe eating, lifestyle choices?
Lifestyle goes such a long way here. Smoking cessation, top of the list. Low alcohol intake. Exercise, endurance exercise, but building muscle mass will naturally increase your testosterone levels. And diet. Low sugar, leveraging protein in the diet. So these lifestyle interventions can really make a huge change in quality of life for men.
Well, I'm sure there's a lot of men listening going, maybe this is why I'm feeling this way. So Thank you so much, Dr. Kumar. Always so informative. Really appreciate having you here.